In so-called primary care deserts, there aren't enough primary care doctors for the population. KENS 5 reporter Jeremy Baker shares how telemedicine helps in tonight's Wear the Gown.
Following the pandemic, only 9% of Texas counties have enough primary care providers to treat their residents. That's just one reason why telemedicine is so important for those without access to a physician.
A lot of the businesses started to have trouble with COVID, decrease in workforce. So did the healthcare offices,
That decreased the number of providers too, especially in urban areas.
which leads to the whole idea of health equity, how it's not equal among certain populations.
One of the big pros of telemedicine, not having to be around other sick people. A study by Independa in November of 2022 found over 90% of Americans used telehealth in the last year. 90% of those say they enjoyed their experience, and 71% of those using telehealth did so on their smartphones.
That was a big issue for a lot of people when the pandemic started. But also having the convenience of seeing anyone pretty much anytime, anywhere is something that telemedicine does offer.
According to Teladoc, they've delivered more visits in Texas than any other U.S. state or territory, resulting in improved diagnoses and care. Diagnoses for depression are up 85% among seniors in the state. Among Gen Zers, diagnoses for anxiety are up 33% and hypertension 17%, two conditions that are often linked. And millennials accounted for 43% of long COVID diagnoses in Texas in 2022.
We're trying to trying to help with this whole health inequity issue.
Dr. Hendricks also told us within 10 years, up to another 50,000 providers are expected to age out of the system, which is why telemedicine will become even more important. Jeremy Baker, KENS 5.
Bill Taylor joined